How precise is the ANA test for lupus antibodies? Imagine trying to solve a puzzle where some pieces look similar but don't fit perfectly. That's often how diagnosing lupus feels, especially when using the anti-nuclear antibody test. The ANA test is a common tool doctors use, but its accuracy isn't absolute. It's important to understand what this test can and cannot tell us about lupus. The ANA test detects antibodies that target the nucleus of cells, which are common in people with autoimmune diseases like lupus. In fact, most people with lupus will have a positive ANA test at some point. However, a positive ANA isn't exclusive to lupus. Many healthy individuals, especially women and older adults, can also have positive ANA results without having any disease. This means the test is very sensitive but not very specific. The sensitivity of the ANA test for lupus is high, meaning it's good at picking up most people who have the disease. About 95% of people with lupus will have a positive ANA test. But the specificity is lower because positive ANA results can also occur in other conditions like rheumatoid arthritis, scleroderma, or even in some infections and healthy people. So, a positive ANA alone doesn't confirm lupus. To improve diagnostic accuracy, doctors look at the pattern and level of ANA antibodies. For example, a homogeneous pattern might be seen in lupus, but it's not exclusive. They also test 4 other specific antibodies, such as anti-double-stranded DNA and anti-Smith antibodies, which are more closely linked to lupus. These additional tests help confirm the diagnosis when combined with clinical symptoms. The ANA test is also used to monitor disease activity in some cases, but it's not a definitive measure of how active lupus is. Because of its limitations, the test is just one piece of the puzzle. Doctors consider symptoms, physical exams, blood and urine tests, and sometimes tissue biopsies to arrive at a diagnosis. In summary, the ANA test is a valuable screening tool because of its high sensitivity, but it's not definitive on its own. Its results need to be interpreted carefully alongside other clinical information. If you suspect lupus or have symptoms, it's essential to consult a healthcare professional who can evaluate all the findings comprehensively. Remember, each person's experience with lupus is unique, and diagnosis involves a careful, personalized approach.